In this video, we will learn about gather approach, which is used in the family planning counseling. So gather approach is a counseling framework that is used in the family planning and reproductive health services so that the client should receive a respectful, informed and supportive care. And it's an acronym that outlines the steps a health worker provider should follow when he or she is interacting with a client. So in the gather approach, G stands for greet, A stands for ask, T is for tell, H is for help, E is to explain, and R is for return or referral. So we will see their meaning one by one in the upcoming slide. So first is the greet the client. Means we have to make our client comfortable, we should welcome them, and we have to show respect and establish trust with the client. We have to assure that the meeting will be confidential, and the rationale is that we have to set a positive tone, and so that that lays the foundation for the productive counseling session. Then A stands for ask the client about their needs. So we have to find out what the client already know about their family planning, and we have to ask about their reproductive goals. Means how many children she is already having, or is there a desire for the birth spacing, or there is a desire for long-term contraception. The couple has already completed the family, and if they have used any particular method in the past, what are their preferences, what are their past experiences, and what was the reason for the discontinuation of any particular method. And we have to also ask that if the female is interested in any particular family planning method. Then T stands for tell the client about their option. So we have to provide an accurate and comprehensive information about the different contraceptive method which are available. And we have to also explain how each method works, its effectiveness, what can be the possible side effect, and how to use it. So we have to tailor the information according to the woman needs and the situation. And we can also use some visual aids or model if it is required to explain the various family planning methods. Then H stands for help the client to choose. So we have to assist the client in choosing a method that fits their lifestyle and need. And point to remember here, we do not decide for that couple or for the female. We have to only assist so that the client can choose a method. And we have to respect the choice without any pressure and judgment. And if there are any questions regarding any particular method, then we have to answer that question. And we can also assess the knowledge about the selected method by asking her repeat the question or repeating the key details back to you. Then E stands for explain how to use the method. In this we have to give clear instruction how to use the selected method and what to expect, what can be the possible side effect, and we have to tell them when to seek help or when to come for the follow-up. For example, if a woman has chosen IUCD, then there may be menstrual bleeding changes, or there may be warning signs that indicate the person to again reach to the healthcare provider. So we have to explain all the things to the female. Then R stands for return and follow-up. We have to encourage the client to return for the follow-up visits, and we have to provide information on what to do if they have problem. So we have to assess the client satisfaction, check for any concern or problem if she is having after the adoption of any family planning method. And if in case it is needed, there are some sort of complications or some side effect that cannot be managed at the level of health facility, then we can refer the woman.